What unique insights can narrative samples provide about a student's language abilities that might not be captured through traditional testing methods?
Great question. Narrative assessment allows us to observe how language works in a meaningful communicative context. Unlike many tasks on norm reference tests, narratives require children to organize information, establish relationships among events, communicate perspectives, and construct coherent stories. One of the reasons why I value narrative assessment is that it's present in any culture. Kids are telling stories across culture. And narrative assessment allows us to both examine strengths and weaknesses simultaneously. We can evaluate story structure, grammatical cohesion, vocabulary, inferencing skills, perspective taking, and overall communicative effectiveness, while also considering how the child deploys AAE. So a child may use AAE forms while demonstrating excellent narrative organization, rich vocabulary, and strong inferential skills, abilities that might be overlooked if we focus exclusively on surface grammatical forms. Narratives also provide opportunities to identify patterns that are consistent across dialects and languages. When clinicians examine both narratives at the macrostructural level and the microstructural level, that is, when they're looking at the overall story organization as well as cohesion across clauses, they gain far more comprehensive picture of ability, language ability, than a standard score alone can provide. Perhaps most importantly, narratives allow students to demonstrate competence in a way that feels more natural and culturally meaningful than many traditional testing tasks can do. Also, in contrast to a standard score, information that we can derive from a narrative can also be used to monitor progress once a child is enrolled in therapy, and can be used to establish treatment goals.